I'm Dan Collins with Mercy Medical Center in Baltimore, Maryland, and you're watching Medoscopy. Thank you for joining us for today's procedure. Our guests are Doctors Gregory Gasbarro and Clayton Alexander of the Shoulder, Elbow, Wrist, and Hand Center here at Mercy. Thanks for joining us, gentlemen.
Thanks for having us.
First, a little background. Why orthopedics? Why medicine? Is this something that was interesting to you even in your childhood? Was there a family connection?
For me, I decided late, actually. So I decided my senior year of college to go into medicine. I was doing an engineering degree in college and looking at engineering jobs as a senior. And after I played college soccer, and after the senior season, I decided, going around doing these interviews, I was not happy with what the future looked like. So I totally pivoted, and it came along the lines of I didn't want to develop the implants, I wanted to put them into people. That's how I initially started, even before medical school began. And that's why I decided to pursue a medical career, and it kind of carved my path from early on. I kind of knew what I wanted to do. So it wasn't something I thought about when I was real young.
For me, just the opposite. My parents were both in medicine, and I was encouraged from an early age to keep an open mind, but I always had a science-leaning mind, and I decided to follow in their footsteps and go into medicine. My dad's a surgeon, but a different kind of surgeon, and I thought I wanted to sort of blaze my own trail, and I was interested in orthopedics in medical school very early on. In fact, Dr. Gasbarro had something to do with that because we went to medical school together. He was a year above me, and he was gung-ho orthopedics, and I caught his passion and decided to do the same thing.
Well, if not orthopedics, maybe another specialty, or you just like there was nothing else?
For me, and looking back, there's probably nothing else. I probably would have coached soccer, done something with teaching, which I'm still really passionate about, and a medical tilt to it now, but I'm not sure I could do any other medical specialty.
And again, just the opposite for me. I felt like I liked every rotation that I did as a third-year medical student, and I could have seen myself being happy doing any of those things, but for me it was the personalities and the mentorship that I got that sort of led me to feel like I was a part of the orthopedics team and something that I was most passionate about of all of
these opposites will be a theme. That's why we get along so well.
Now, are either one of you from the area, or where are you both from originally?
I'm from Northeast Ohio, so I grew up outside of Cleveland and Akron.
Oh, Indians fan?
I am. You got to call them the Guardians now, unfortunately.
Oh, right. I forget.
Yeah, but I am. I like the O's, though. I'll follow them.
Yeah, and I grew up in Howard County, suburb of Baltimore, and I lived here almost my whole life except for college, and probably will never leave.
Now, as someone who's a native of the area, talking to someone who is not a native of the area, how would you sort of school Dr. Gasbarro as to, the Maryland experience and the Baltimore experience? I'm from the area, and I've been told that, like this region, it's kind of a clique that you have to kind of earn your way in. Would you say that's the case, or how do you feel about that?
That is the case. I mean, I've heard you talk about it on your show previously. It's very much a small town, Baltimore. People earn their way in, but there's something to be said about being from Baltimore.
I married into it.
Yeah, true. Let's go, hon.
Yeah.
Now, Dr. Gasbarro, you studied biomedical engineering, Case Western Reserve University, where you may develop some new devices and equipment. Now, you mentioned that you wanted to get from making these things to actually putting them in, but have you found that as a surgeon, what you learned in engineering has benefited you in any way?
Yeah, and then I'm actually doing the opposite now. So because I'm putting them in, I can help the engineers with some of the things that I'm doing outside of Mercy, develop things and help the patients in a forward-thinking way. I think that it helped me learn how to study for sure, doing an engineering degree. So getting to medical school, it really basically managing your time, getting through the day and making sure you're task-oriented has helped me during the process. So I still use some of the things, but not the direct knowledge you gain in engineering school. I mean, some of that stuff at this point feels so far over my head that I'm kind of glad that I took the path that I did.
Now, you're both in orthopedics, but as we mentioned at the top of the show, you're with the shoulder, elbow, wrist, and hand. So why not hip and knee or back?
You want to take that one?
Sure. The upper extremity is very unique. It's your manipulation with the world, mostly through your hands, but to a lesser degree.
You need a
your
base
shoulders.
though to get the hand where you want to go.
And it has unique implications in terms of weight bearing. You don't have to think about weight bearing like you do with hip and knee and ankle and spine. And it has unique mobility. And I think it's just an interesting problem that doesn't have sort of the same, carpentry ramifications of the lower extremity. There's a lot more art to it. And especially in my field, in the more distal part of the extremity, there's a lot more plastic surgery art to it. You have a lot more nerve and skin and wound issues and things that need a more unique problem than the typical orthopedic problem. So that's why I feel the upper extremity is a unique and privileged area to take care of.
For me, it's the anatomy and the patients. So I fell in love with limb anatomy in medical school. And then as I went through medical school, I really kind of focused on shoulder anatomy. And for whatever reason, the shoulder just kind of made sense to me spatially. And then, as you go through medical school and then you finally go to residency, throughout residency, I just was really kind of attached to mentors that were shoulder doctors. And I liked the patients, the clinics, I enjoyed the surgeries. So it was those factors, and the ability for me to do a shoulder fellowship to focus and specialize in one joint was important to me. And I get to treat patients anywhere from 15 years old who are high school athletes to somebody that's older with arthritis. And so it's really fun to treat a wide range of patients with different problems and focus just solely on a single joint and hopefully become an expert on that area.
Got a question for you out of left field. A lot of television shows and movies show hospitals, doctors, saving lives, all that sort of thing. How do you view what you see? I mean, are they getting it right or are they getting it wrong, in your opinion, for the most part? Or do you even watch those things? You probably don't even have time to watch these things. So
I think those shows over-dramatize everything, and they're mostly in the fields that are life or death, emergency medicine, the trauma, general surgery, things like that. And I think our fields are much more life-paced as opposed to the intense, scrutiny of the ER and things like that. And so ours is much more function-based than it is life or death. Can we help someone who's in pain get back to doing the things that they want to do? And that's sort of the mantra of orthopedics in general.
Yeah, you want to get them back to the playing field. You want to get them back to their heavy labor job. You want to get them back to playing golf or tennis. But a lot of what we do too has to do with more than just shoulder and wrist and hand. It has to do with mood. So patients that are living chronic pain, if you can get them out of that chronic pain, it makes a world of difference for them in many other areas of their mental health and their overall well-being.
You make a good point. Usually in TV and movies, it's some sort of emergency situation. Back in the 90s, I did some extra work for Homicide, Life on the Street, and there were a few scenes where some detective got shot and they were yelling, "Get him to mercy!" And it was like, I think he needs to go to shock trauma. Yeah. Hey, that's how that goes. We'll take a break and we'll return with our next segment of Medoscopy.
My name's Dr. Gregory Gasbarro, and I work at Mercy Medical Center in the Shoulder, Elbow, Wrist, and Hand Center. I think we have a very unique environment here at the Upper Extremity Center. We have a very collaborative environment. We're family-focused and oriented.
I'm Dr. Clayton Alexander. I specialize in care of the upper extremity, but specifically in the elbow, wrist, and hand. We take care of different conditions that range from trauma and acute injuries all the way to degenerative and chronic conditions like arthritis and chronic pain. The patient is at the center of the care. The patient can get in quickly, they get choice about which doctors they want to see, and we can take care of them in a very expedited manner.
I specifically focus on conditions of the shoulder, including sports injuries and degenerative conditions such as arthritis. I always think of a patient as a family member. So if I'm taking care of my my mother, my father, my brother. And I frame my conversations with patients in that way.
For the right patient, we offer minimally invasive approaches as much as we possibly can. So, for example, in a patient that has carpal tunnel, we offer an endoscopic carpal tunnel release. The benefit to the patient with minimally invasive surgery is usually return to work or return to daily activities a little bit sooner.
Going to the operating room, I don't take lightly. Each patient that I operate on when I do a shoulder replacement, it's really getting an individualized, personalized shoulder. I get a preoperative CT scan, and in that CT scan, I can put it into a three-dimensional model. In that virtual planning environment, I'm able to position the implants for the patient specific to their shoulder, size them specific to their shoulder. I think that offers a number of advantages for the patient and is an up-and-coming technology.
What I like best about orthopedics is that we can treat things acutely and get people back to 100%. But something that affects their upper extremity, that impairs them from doing something they love, like playing golf or cooking dinner, we can cure that and get them back to doing the things that they love.
As frequent viewers know, one regular feature of our program is a sort of show and tell, where guests bring in something, some item, could be a book, could be a photograph. We even had a guest who brought in their dog. Who knows what? But it's important to them in some way, symbolic of who they are and what they're about. Dr. Alexander, I'm going to start with you. What have you got for us?
I have a medical textbook that was my father's when he was early in his training. And I remember looking at it on the bookshelves when I was a young child and thinking, there is no way that it's actually this complicated and that someone could know all of this stuff. And as I progressed through my training into college, into medical school, I remember reflecting back on this and comparing it to the more modernized versions of it. And it's remarkably similar, other than some of the texts are often in Latin. And it represents for me just sort of my roots and my family's encouragement into going and support and going into medicine.
And so your father was in medicine as well. What field?
He's a urologist.
So I was wondering whether, in terms of what, it's interesting to look at old medical books and see what they were talking about and what was the theories that they had at that time about why there were problems. And I was just wondering if you had any moments now where you look through some of these older books, like they thought, what?
So there's actually, even today, that comes up where a patient comes in and they say, well, I thought I could do this for this problem, Epsom salt soaks for my arthritis in my hand. And, maybe it makes them feel better, but, we've definitely progressed in our medical knowledge. And, so I still encounter that even today.
Dr. Gasbarro, what do you have for us?
Mine's different than a book. So if you zoom in on this, it says FF. That stands for Freddie Fu. Freddie Fu was the chairman of orthopedics at University of Pittsburgh. He passed away in September of 21. So this is an alumni pin basically commemorating him. He is basically was a giant of sports medicine and orthopedics and had done a lot of things, particularly in the knee and also in the shoulder early on in the 1980s, doing a lot of biomechanical studies on the ligaments of the shoulder and how they interact with one another. And he really gave me my shot in orthopedics. He handpicked every single resident for almost 25 years in the University of Pittsburgh's program. And he was, like I'd said previously, my career and my interests a lot had to do with my mentors. And he is one of the biggest mentors that I've had. And this is something that a lot of us alumni wear to meetings, and I try to wear it around the hospital. Nobody knows what it means, but it means a lot to me, and it commemorates his memory and what he means to all the University of Pittsburgh orthopedic surgery alums.
Thank you. Dr. Gasbarro, you were at Case Western Reserve University and served as a 2-year captain for the varsity soccer team, which made the Sweet 16 in the NCAA tournament in your senior year. So soccer, why? Why is that your sport?
I played a lot of sports growing up. I started soccer when I was 4, and I initially played locally, and then got involved with the traveling team, and then club teams, and made it up to even the Olympic development program type of level. And I traveled the whole country, the whole world playing soccer, and it meant a lot to me as a kid. Being with the guys, with a group, a lot of learning different leadership skills, teamwork, and it just continued. It was an outlet for me from school. A lot of friends did it with me, so it's just a natural thing as a kid growing up doing. And I wanted to do it in college because it helped me again with those key principles of teamwork and leadership. Being a captain, I was a captain in my high school teams, captain a couple years in college, and it allowed me to sort of hone in on those skills, and it was really enjoyable and allowed me to work on time management during college and getting through the engineering courses. So I think being on teams leads to a lot of different things later in life that can be useful for living.